Hello, I'm Dr. Elena Klemenko, an internist and a certified integrative and functional medicine physician in New York City. Today, I want to talk to you about a condition called chronic candidiasis or Candida overgrowth. Candida is the name of one of the hundreds of fungi that live in our body. It's normally present in our mouth and intestines and actually helps us to digest food and even make some vitamins. It is our friend as long as it stays in balance with other organisms. However, sometimes Candida can grow out of control. When it happens, it causes one of the most common types of microbial dysfunction in the world, a yeast infection. When Candida grows beyond healthy limits, you might experience a variety of symptoms. These can range from single or repetitive yeast infection, various abdominal symptoms, from constipation or diarrhea to bloating and sweet cravings. Candida overgrowth can manifest with repeated infections such as chronic urinary tract infections or sinusitis, brain fog, and the inability to lose weight in spite of doing everything right. Chronic Candida overgrowth can even lead to long-term psychiatric conditions like attention deficit disorder, depression and anxiety, as well as debilitating autoimmune diseases like psoriasis, multiple sclerosis, or Hashimoto disease. So what leads to yeast overgrowth? One of the most common causes is a diet full of sugar and refined carbohydrates. Excessive consumption of alcohol is a part of it. Sugar is a perfect environment for Candida to multiply and grow out of control. Ironically, now in the medical community we know that some people crave even more high-sugar foods as the Candida progresses. It is almost like the yeast begins to rule your body and command your body to do what it wants to do in order to prosper and multiply. And Candida loves sugar. Remember that. Taking antibiotics is probably the second most common reason for Candida overgrowth. Antibiotics kill off the other bacteria that would normally keep Candida growth under control. That is why it is so important to take recovery probiotics course after even a short course of antibiotics. Chronic use of oral contraceptives or immunosuppressive drugs also may cause chronic yeast overgrowth. Treatment of chronic candidiasis or Candida infection in the body often requires a short or prolonged course of antifungal medications, depending on the severity of the condition. The treatment can be pharmaceutical, which have more side effects, or herbal, which is gentler. Be proactive about your health. Consult with a functional medicine doctor in your area to further investigate whether you have chronic candidiasis or Candida overgrowth.